Welcome to today's webinar. We're going to talk about our brand new pharmacology text called Pharmacology for Nurses by Blaine Templar Smith. My name is Jennifer Stiles. I'm the Senior Marketing Manager for Nursing, and I'm joined by two of my colleagues today, Mary Colleen Liberty, Technology Product Manager, as well as the Executive Editor for the series, Amanda Martin. And we're going to hear from both of them today regarding this text. So we're truly excited to talk about this groundbreaking new text for nursing and wanted to tell you a little bit about why we created this text in the manner in which we did. We know that pharmacology is a foundational yet complex course for undergraduate nursing students, and it can be one of those courses that can be challenging to teach, and it also can be an area where students struggle and it can be a challenge for them to learn. And we've heard from nursing instructors for many years now that they're looking for a text that's a little bit more concise, something that's easier to read, a little bit more student-friendly. So we responded to the market with a different approach to teaching pharmacology for nurses, which you'll find when we go through this text in just a little bit. So faculty have gave us some glowing reviews so far. They've responded very well to the text that they were able to review. For instance, one of our nursing faculty, let us know that the case studies and the questions and answers were an excellent touch, and also cites that critical nursing material, including pharmacology and cardiac medications, are also very strong. And she's guessing that it will be well received by students, and she's correct. We've done a little bit of pilot testing, and we'll talk about that in just a few minutes as well. Additionally, we've had another nursing faculty member tell us that this text is very well written, and it truly represents what each medication is with the mechanism for action in the body, which is very important, and it makes it very easy to understand the reason for the medication and the actions in the body. And again, this nursing faculty member also likes the case studies and the questions at the end of the chapter as well. Furthermore, this text is student tested and approved. Earlier this fall, later in the summer, we did a pilot study with 80 or so nursing students, and we gave them one of our chapters, Chapter 3 from the text, entitled Medication Administration. And 86% of those students who were surveyed agreed that pharmacology for nurses made this complex content easy to understand. So it's really fantastic to get both the student and the instructor approval on the first edition of this brand new text. This slide was taken from the research study and really just breaks down some of the student answers and lets us know why they voted the way that they did. For instance, students cited the fact that the author effectively utilizes understandable language to explain difficult concepts and also utilizes images, tables, and charts to clarify and back up the content found within the text. This slide tells us that 83% of those students who were surveyed agreed a lot that after reading Chapter 3 that they were confident in their understanding of the concepts explained in the Medication Administration chapter, Chapter 3. The students also cited a few other key reasons why they felt this way, such as the fact that the text was clear and concise, easy to read, provided detailed explanations, and also featured tables and charts and images, and that the content was very comprehensive. So overall, from our student survey, this text has been very well received so far. This particular student explained and tells us that they liked the fact that each of the 8 medication rights that they read about, that instead of just listing them, that they explained why those rights were important. So again, backing up that the approach, the strategy, and the layout is what students are looking for as they learn this complex content. Another student tells us that the text really helped the student connect the dots to proper administration of oral medication, and we'll see that echoed a little bit later on as well. And here again, another student response, just reinforcing the fact that the images are really important for students, that anything from, medication administration, that they do very well when they're given images and other sorts of visuals to really represent this content. In comparison to the competition, one of our students tells us that one of the competitors' texts that she's used to using that has many editions out, that text is very wordy, but when they opened up the section, Chapter 3 on medication administration, they found that the text was easier to digest and easier to learn. So let's talk a little bit about pharmacology for nurses. The beauty of this text is that it's written by nurses for nurses, and it was expertly overseen in terms of a project by Blaine Templar Smith. He's a registered pharmacist, and he also has a PhD, so he's very qualified in this topic. And he also managed a team of 14 experienced nursing contributors, so we have a wealth of knowledge and many years of experience behind this text as well. It also focuses on that critical need-to-know information. The text is clear, it's concise, it's also student-friendly, so everything that we've heard from nursing instructors that they're wanting in a pharmacology text, we've really rolled into this edition. Another great feature is that we've covered the basic anatomy and physiology review just to give students a refresher and to bring them all up to speed so that it's helpful when they're learning about different drugs. As you'll see when we go through one of the chapters, and Amanda will walk us through, the text is very creative in its design, which also helps students learn. We've heard from students that those images and tables and graphs and charts really are helpful in providing the visuals that students need to learn, and you'll see that's pretty pervasive throughout the text as well. The chapters have also been written according to drug groupings to help students learn the different types of drugs, and it also features coverage of pharmacodynamics, which is very important to these students as well. And lastly, this text also features Navigate 2, which is a robust digital package that truly enhances the teaching and learning experience. And we're going to talk a little bit about Navigate 2 a little bit later on in the presentation. So this text works for several different reasons, and the first being that the critical content is covered. The text may take on a slightly different approach, but we've definitely listened to the market, and we're covering everything that undergraduate nursing students need to know regarding pharmacology. It's represented in the format that the market has been asking for in terms of being something that's engaging and student-friendly. It takes the fear factor out of learning pharmacology, and I think we heard that echoed in our student survey and some of the student comments. They like the fact that there's a lot of visuals and that the information is clearly spelled out, making it easier for them to learn. And furthermore, it's student-tested and it's instructor-approved, so it's a real testament that we're on the right track with this first edition. So at this point, let's take a look at Chapter 5. I think that's the chapter that Amanda is going to show us. So I'm going to turn the presenter rights over to Amanda. You're going to see the screen switch. So I'm going to let Amanda take it away.
Great. Thank you, Jen. Give me just a minute here. We'll pull up the chapter for everybody. And Jen, are you able to see the chapter on my screen?
Yes, I can see it.
Okay, great. So I'm excited to give you all some additional information on the approach and the layout of the book, along with some more information on really what our overarching goals were here. And we'll do a brief scroll through of this sample chapter, which is Chapter 5 that you can see on your screen. And as Jen alluded to, this textbook is a result of many requests from the main editor's nursing peers to develop a pharmacology text that's easier to read and that's really designed specifically for the needs of nursing students. It was designed to delve more straightforwardly into those pharmacological points of most critical importance to these students. It really is kind of a cut-to-the-chase, need-to-know approach, and it's crafted to take away some of that intimidation factor and engage students directly in the content more easily and very visually. Another unique strategy that the chapter authors have employed is the grouping of drugs that Jen mentioned, and they've done this as often as possible. So the editor and chapter authors chose to minimize minor variations among drugs, which allows the student to learn the pharmacology of the systems without being overburdened by the sheer number of drugs that affect each of those systems. So you will see in the chapters, once you get a chance to take a closer look, that an example drug is typically used to illustrate the fundamentals that can be applied to other drugs of its class, with the understanding that there may exist differences, but the core pharmacology really remains the same. So as we delve into this sample chapter, Chapter 5, you'll note that we've purposely designed the content in a layout that's meant to be easy to read, it's meant to be streamlined, and broken up by art, diagrams, and key features along the way. And we all know it and hear it so often that students just really aren't reading anymore. So keeping that in mind with this textbook, we're choosing to offer something that will hopefully draw the students in and perhaps give them a chance to learn this content without being turned off or turned away by the daunting volume of content presented. So I'm going to scroll through the chapter for you quickly here. We open up, of course, with the title and authors as usual and some key terms. And those key terms are meant to begin introducing students to the vocabulary that they'll see throughout the remainder of the chapter here. We move on to the chapter objectives, which is a typical format to follow with the chapter opener, I know. and outlines key information here encountered throughout the chapter, which should help students note at the very start what they should be taking away from the chapter once completed. Our introduction we've designed, as you can see, it really meant to stand out and provide a quick overview of what they'll encounter along the way as they're reading through the chapter. I'll scroll through here and give you an idea of what we mean when we say we're trying to be as visual as possible and breaking up the content as much as possible with those visual diagrams, tables, boxes along the way. So if you bear with me, I'll scroll down to, let's see, page 136 here, which is the first time we'll see the introduction in this chapter of a best practices box. This is a feature that's meant to highlight key concepts, methods, techniques, and so forth that are covered throughout each chapter, but really are those things that students should note and take with them once they're done reading. Scrolling down a little further here, you can continue to see sort of the layout, the design, the headers, and different call-outs we have along the way, meant to make this an easier and more enjoyable read for students. You'll continue to see these best practices features show up. I know I'm scrolling through this quickly, so please forgive me if it's hard to read, but we will give you a closer look at the actual chapter later on after the webinar. And down a little further toward the end here, what you'll see is the layout towards the end of the chapter. We follow up the chapter with a chapter summary and really try to break down into the simplest form what they've gathered from this chapter along the way. There will be chapters where it's bulleted in this format and others where it's presented as in a paragraph format, but the takeaways are the same in terms of this being a helpful feature. We then, at the end of the chapter, delve into case studies. There's typically 2 per chapter, so you'll find them here at the end, and they're meant to provide students with that ever-important application-based learning and really offering them to a chance to think critically after they've gleaned what they can from the chapter content. And then we move into, in each chapter, discussion questions or critical thinking questions where they're given the chance to analyze and evaluate what they've learned along the way. And of course, some references here to let them know where this chapter content has come from. So I hope this was a helpful walkthrough. At the end of the hour, I know Jen will be opening the line for questions, so I would encourage you to make note of any questions that may have come to the surface along the way, and we'll be happy to address those for you. So with that, I'm going to turn it back to Jen, and she will begin discussing for us our robust Navigate 2 offering to go along with this book. So as we make the switch here, you may notice a momentary flickering or freezing of your screen, but that should correct itself pretty quickly.
Great, thanks, Amanda. That was just a quick preview of the chapter, but we actually have 2 additional chapters posted on the catalog page, and at the end of the presentation, you'll see a few different URLs where you can go and you can download them for free. So that's Chapter 1, Chapter 3, and Chapter 5 that you saw here. So what is Navigate 2? This is a new digital package that we're offering with most of our textbooks, and you may have heard of this, and we're truly excited to offer this for the Pharmacology for Nursing textbook. And the Navigate 2 Advantage Access unlocks a comprehensive and interactive ebook, student practice activities and assessments, and over 20 highly interactive animations. And Mary Colleen is going to show you just several of these animations, and they truly bring learning to life for students. We know that pharmacology is one of those areas that students need a lot of, visuals are helpful, videos are helpful. These animations are especially helpful. We also have a full suite of instructor resources and some learning and analytics and reporting tools. In terms of the ebook, as I just mentioned, we have those 20-plus animations. There are interactivities found within the ebook. This is just a snapshot of what the ebook looks like for the Pharmacology for Nursing products. Ours is anticipated to be ready in early January 2015. We also feature knowledge checks as well as end-of-chapter quizzes. So the beauty of this ebook is that the student does not have to leave the ebook. They can do a lot of studying, they can do a lot of note-taking, they can do highlighting, they can print from here. So it's kind of like a one-stop shop for the ebook. I know we just did receive a question via the chat, and someone was asking what the cost is. This is actually included in the cost of the textbook. So each new copy of the textbook features an access code for the Navigate 2 Advantage package. In terms of the Study Center, it's full of learning objectives, flashcards, as well as practice activities. And again, this image on the screen shows you what it will look like for Pharmacology for Nurses. In terms of assessments, we offer midterm and final assessment, chapter quizzes, projects, and discussion questions. So we've definitely put a lot of time and resource into developing, a wealth of resources for the student that they can learn and for you as the instructor as well. In terms of teaching tools, we have presentations that are available in PowerPoint format, a sample syllabus, and there are LMS tools that are within the Navigate platform, which is built on Moodle. This is our complete list of animations that are available, and at this point, I'm going to turn it over to Mary Colleen Liberty. She's going to walk us through just a few of these animations so that you can see them in action. Again, the screen is going to change just briefly while we do the presentation share, and I'm going to let Mary Colleen take it away.
Great, Jen. Thanks so much. So glad to be able to show you some animations. Okay, everybody should be able to see it. And we have a couple of animations that I'm going to be showing you. And as Jen mentioned, and also Amanda, with this text, it's so critical to be able to really offer students some great tools. And we feel that multimedia is a great way to offer students specific understanding of those concepts that are just a little bit harder to understand when they're, in an illustration or it's a process, and especially with pharmacology, those processes and skills are even more critical. So let me show you a couple of animations. The first animation I'm going to show you is a very simple one, but incredibly important, and it just goes through the parts of a syringe.
A syringe has three parts: the barrel, plunger, and needle. The barrel holds the medicine. Marks on the side of the barrel are similar to marks on a ruler and indicate the number of milliliters or cubic centimeters the syringe will hold. The plunger pushes the medication out through the needle, delivering medication under the skin or into a muscle. The length and gauge of the needle required is dependent on the type of injection, as well as the medication to be delivered.
And as you can see, very easy for the student to understand. The graphics are simple and easy for them to comprehend. And again, just adding to their comprehension of those concepts. The next animation I'm going to show you is administering a deltoid injection.
The entire upper arm and shoulder area should be exposed to administer a deltoid intramuscular injection. The correct location to give the injection is 1 to 2 inches or 2.5 to 5 centimeters below the bottom of the acromion process. Use an alcohol swab to clean the skin where you will give the shot. Gently pinch the skin and insert the needle into the skin at a 90-degree angle. After you insert the needle completely, release your grasp on the skin. Inject all of the solution by gently and steadily pushing down the plunger. Withdraw the needle and syringe and press an alcohol swab or dry gauze on the spot where the shot was given.
And I'm going to show you one last one. And I wanted to point out these are such great tools for students to use because they can watch them over and over again. So they're also inserted directly in the content within the ebook, so the student has context as well. So again, we've been very careful about choosing animations or concepts to animate that will really help the student in understanding certain processes and procedures. The last one I'm going to show is using an inhaler.
Instruct the patient to exhale completely, and then to press down on the inhaler once to release the medication. The patient should begin breathing in slowly through the mouth within 5 seconds, and keep breathing in as slowly and deeply as possible. If using a spacer, the flat mouthpiece should be inserted into the mouth before inhaling. Next, tell the patient to hold his or her breath while counting to 10 slowly. If using inhaled rescue medicine, wait at least 5 minutes before taking the next puff of medication. Otherwise, subsequent inhalations should be spaced 1 to 5 minutes apart. Finally, rinse mouth with water, gargle, and spit to reduce unwanted side effects.
And that's all I'm going to show you today of our animations. As Jenna mentioned, we have over 20 animations that focus on various aspects of the content within the book. You know, they all have a similar style, but of course, we've worked really hard to work and find those concepts that, again, we feel are going to be most suitable for the student to understand those difficult concepts. And you're going to see a bit of a transition. I'm going to make Jen presenter again.
Great. Thanks so much, Mary Colleen. I think that was really valuable to show how the animations can be used and just a sample of a few of the ones that we have available for this text. And if anybody has any questions, please feel free to ask us any of those questions. You can message me directly via the chat. And in just a few seconds, we will open up the question and answer line for you over the telephone. The last slide that you should be seeing is, it says Transform Your Pharmacology course, and here are just a few different resources for you. If you'd like to request a review copy, you can visit our catalog page at go.jblearning.com/SmithPharma. If you want to download those 3 chapters that I was referencing earlier in the presentation, that's Chapter 1, Chapter 3, and Chapter 5, you can do that. You can get a jump start on this before you receive your review copy. And I also just want to let you know that this new edition publishes on November 1st. And if you'd like to try Navigate 2 and just to check out the product, you can visit our Navigate website at www.jblnavigate.com/2, and you're welcome to see how Navigate will work for other nursing disciplines. We don't have the sample course available yet for this particular text, but we are working on that. And at this time, I'm going to ask Felicia, who's the operator, to come on the line and to instruct our participants as to how they can ask us a question live if they would like to do it that way. I've had a couple questions that have come in over the chat just regarding the pricing of the Navigate 2 package. That is something that is complimentary or actually included with each new print copy of Pharmacology for Nurses, so there is not an additional charge for that. However, it can be purchased if you're not purchasing the textbook. The access code can be purchased separately. And the Navigate 2 package will be available for January courses. Felicia, do we have any questions?
There are no questions at this time.
Okay, great. Once again, if you would like to request a review copy, I invite you to visit our catalog page as well as to download the several chapters that we talked about. And we also invite you to test drive Navigate 2. If you're unfamiliar with our Navigate products, this Navigate 2 version promises a wealth of information for both students and instructors. And it looks like we're going to give you a little bit more time back in your day today. Not too many questions have come in via the chat, and I'll just check in with Felicia one more time before we close out this webinar. Any more questions, Felicia? Has anyone changed their mind?
I have a question from the line of Sandra Poofel.
Okay. Hi, Sandra. Go ahead.
Yes. One of the questions I have is dosage and calculation incorporated into this textbook?
Sure, absolutely. So there's some of that content covered in the medication administration chapter, but there is not a specific focus on that in this book.
Okay. And I have another question. Because they've changed the way the questions are in the NCLEX for pharmacology, how are the questions in the book focused or correlated for prepping them for NCLEX?
Sure. We have a test bank that we'll be making available via our Navigate 2 product, and that test bank is formatted appropriately to the new NCLEX, the recent changes that have taken place. I think the latest were in 2013, if I'm not mistaken. So it is in line with that, and all of those questions are tagged with the level of complexity of the question in addition to the Bloom's taxonomy for that question, so we can get a better idea of how students are performing based on that leveling and categorization of questions.
Excellent. Well, that's good. I'm glad to hear it. I'm liking the basic A and P because the students need that dramatic, unbelievably so, because they forget what they learned the quarter before, it seems like. When you did the testing with your sample group, was that purely with the ebook?
That was actually with the print chapter of Chapter 3. So that was even without the dynamics that we've included today with the animations and so forth.
Okay, very good. Okay, I look forward to getting a review copy and looking at your chapters and going through this because we are looking at continually revising and improving our pharmacology course and looking for a new textbook.
That's great. Thank you. Please let us know what you think when you get your hands on the rest of the content.
Thank you. I will. Appreciate this.
Thank you. We've had a couple more questions come in that we'll try to address via chat here. Amanda asks us, is this most appropriate for the baccalaureate level? And yes, this is intended for undergraduate nursing students. And Mary Colleen, I have a question for you regarding the animations. We have one instructor who's asking, are there any animations that follow the drug through the body?
I am just double checking because we have a bunch of animations that are still in various states of development. So there are quite a few animations that actually are tied to that. We have some that show the impact tied to hormonal interactions, and there are some that are showing various physiological states. We don't have anything that is specific, like the state of a drug on, say, the brain, those sorts of things. What we try to do is tie directly into the content of the text and also look at those concepts that were, in many cases, more difficult for students to understand and where we felt that multimedia would really help them gain a greater understanding and they could go back to it and really review it over and over again.
Excellent. Thanks, Mary Colleen. Felicia, do we have any other questions that have come in via the phone?
Yes, we have a question from the line of Mary Cook.
Okay, go ahead, Mary.
Okay. Unfortunately, I was not able to join when we first started, but what I wanted to talk with you about is where my students seem to have the most trouble are with the adrenergics and cholinergics. How do you do that in this textbook?
Amanda, do you want to address that?
Sure, I can, to the best of my ability. So, Mary, what I'm probably going to end up doing to get an answer to your question is to revisit this with the author. I'm certainly not a content expert with pharmacology, rather on the publishing expertise side of things, but what I can absolutely do is go back to our author and ask them how they've addressed that specifically for you. And I'm sure Jen can collect your contact information for follow-up.
That's, I'm not sure, do you know what chapters are for free? And then I could kind of look at those. Or
Sure. Right now we have posted Chapter 1, Chapter 3, and Chapter 5. I'm not sure that this content falls into those chapters specifically, but I can find out where it does fall and get you that chapter to preview.
Okay, that sounds great, because I know that they just struggle so much with that, and it's challenging. And if they can get that, then they usually do well with the other aspects of the content as well. Thank you.
Thanks, Mary.
There are no further questions.
Okay. Great. It doesn't look like we have any additional questions that have come in via chat. I do want to thank everyone for joining us today. And this text will publish on November 1st, so that's shortly at the end of this week. We're truly excited about this first edition. So we do recommend that you go ahead and request a review copy, take a look at it, and our Navigate package will be available for January courses. And, we have a robust set of animations like you've seen, and we really want to thank Mary Colleen and Amanda for their time today as well. And we look forward to hosting you at another Jones and Bartlett Learning webinar. Thanks so much.